Good morning, everybody. Happy Thanksgiving. How are you doing? Welcome to another one of our live question and answer series here from Tustin Longevity Center in Tustin, California. Every week we sit down with Dr. Ellithorpe or another integrative physician and we answer any and all of your health questions. Just note that this is not meant to take the place of your relationship with your doctor. Any specific medical questions, we're going to answer these questions as general medical advice. Any specific questions, we encourage you to follow up with your physician or make an appointment here. We do offer telehealth appointments. You don't have to come into the office. You can have a visit over the phone, and we're open and we're seeing patients. It is Thanksgiving this week, and I know I'm looking forward to spending some time with family and relaxing a little bit. Just want to let you know, today's Wednesday. Tomorrow we will be closed, but Friday we are open. PA Patel is here. She's available for any acute or just regular follow-up visits, and our wellness store is open as well too, so you can come in and pick up your supplements and prescriptions. Dr. Althor, thanks for joining us today.
Well, thank you.
How you doing?
I'm blessed.
Me too. So we are going to be looking for your questions in YouTube. There should be a chat section over here. You do need to be logged into YouTube to see that, but you can post your questions. We're monitoring them here. I'll ask the doctors your questions. You can also email your questions into us. office@tlcdoctors.com is our email address, and just make sure you put in the subject line question for the live Q&A, and the team will make sure that gets to us, and we'll answer that question on the following week. Okay, doctor, do you have any information that you want to kick us off with and share?
Well, yes, I do. Last week I had, or the week before, I brought up, and if you look at the bottoms of the place, it'll say show more.
In the description.
We're posting these articles so you can look them up yourself. I reviewed a article by the New England Journal of Medicine that had a population of 25 people that had a modest favorable value of the mask, okay? And that just recently came out. I found another article on masks. This was done in Finland. You may have heard of it if you're following this.
Sorry about that.
This was published November 18th, 2020, so last week. However, this study was performed between the months of March and July in Finland at the height of the initial pandemic. And the question I have is, one, why did it take so long for this to finally get published in a peer-reviewed article? And here it's critical of masks, okay? So this is in the Annals of Internal Medicine, published 18 November 2000. It is a randomized clinical trial, so this is a high-quality piece of information. I marked out here that they had a total of 3,030 patients were randomly assigned to the recommendation to wear masks, and 2,994 were assigned to control. And there were 4,862 that completed the study. And infection with SARS-CoV-2 occurred in 42 participants recommended wearing the mask, who had the mask on, and 53 in the control participants. So the net effect is that it was really not clearly advantageous to have the mask on. In conclusion, the recommendation to wear surgical masks to supplement other public health measures, because they did ask them to socially distance, wash their hands, not be in crowds and so forth. The recommendation to wear surgical masks to supplement other public health measures did not reduce the SARS-CoV-2 infection rate among wearers by more than 50% in a community with modest infection rates. So their goal was to see, a 50% reduction, and they did not. So why it took so long to get this published, I don't know. Why the more recent one that was done got quickly published and only 25 participants, and that's in a VA group. These had many thousands of patients in it. And if you look and read the study yourself, you'll see that these are teachers and preschoolers and retailers and office workers and postal service. So this is a nice swath of the population that was in the study.
Okay.
The next thing I want to bring up to you is I want you to go to YouTube, and I want you to look up, and I've talked about this many, many months ago. Early, I think this was January, I brought this up on Dr. Paul Marik, M-A-R-I-K. Dr. Paul Marik was the gentleman who runs the intensivist care unit in Virginia, who did the vitamin C high-dose drips. Remember, that was in 2019. And I reported on the valuable impact of acute respiratory distress syndrome, getting high-dose vitamin C for the flu,
right,
and acute respiratory so the same physician is fed up with the situation. He is on these YouTubes talking about how the NIH and the World Health Organizations are saying two different things. They have no recommendation, neither of them, for the pre-hospital phase. Okay, unless you get into the hospital, they have no recommendations. And the NIH says once you're hospitalized, use remdesivir. The World Health Organization says don't use it. And so he is really fed up. So if you look up Paul Marik, M-A-R-I-K, his website, by the way, is evms.edu/COVID care, okay? And if you look on his website, you will see that he has care for clinicians. This is what his first page will look like on the internet. And here he does an exhaustive layout of the protocol for the pre-infection phase or prevention, okay, as well as the clinical doctor's advice for pre-hospital symptomatic. And then he goes into very exhaustive for the hospitalized and then the intensive care unit. So Dr. Paul Marik, M-A-R-I-K, I want you all to go to his website.
You should look him up on YouTube as well, because
yes, because here you'll see just 12 hours ago, he and Dr. Mobeen Sayed, S-E-Y-E-D, are on a YouTube interview in which he lays out the contradictions between the NIH, the World Health Organization, all the promoted studies out there, their impacts. He has graphs and stuff, and I'm going to show you some of them here. And he is fed up that there's no preventive or pre-hospital, pre-clinical advice. And so what I want to do is I want to talk to you briefly about that. EVMS stands for Eastern Virginia Medical School, and it's evms.edu/COVID care. Okay, all lowercase. So look at that. Now here is the protocol that he has put out. And I've brought this up to you already. I've been following this all along. None of our patients have gotten ill, and we've been doing this all along. But if you want an intensivist instead of a good old family practice general doctor like me, I'll give you these fancy names and doctors who do it. But he has put out a whole protocol from Eastern Virginia Medical School Medical Group, EVMS, Critical Care COVID-19 Management Protocol. And it is called Math Plus. And I already reviewed this many months ago where it talks about what each of these things stand for. MATH plus, methylprednisolone, ascorbic acid, thiamine, heparin plus, okay? I went over this about 8 months ago when this all started. So this is his whole protocol. And then all of these pages are the references, several of which I've already reviewed, but I've boiled it down to some of the graphs. And here is a table on page 3 of that protocol where it says pre-exposure or post-exposure incubation time And then he puts whether or not it's hydroxychloroquine, remdesivir, lopivinar, which is another antiviral, interferon, which is like a cytokine management, tocilizumab, which is an interferon also, or a cytokine management, convalescent serum, corticosteroids, and ivermectin. And what he does is he color graphs these to what the published data in randomized controlled studies. So we're using the highest value. And what he clearly finds is we can do a lot in prevention, in the prevention column. And hydroxychloroquine is in that group, okay? The benefits, because it takes a long time to build up the half-life of hydroxychloroquine, the benefits are not as clear as now the new, and I've brought up ivermectin before. That's another, like hydroxychloroquine, which is an anti-parasite malarial. Ivermectin is an anti-parasite, you give it to your dogs for heartworm, okay, all the time. Both old, patent, gone on these things, cheap drugs have been in the circulation for many, many decades, both these things, but ivermectin is now showing tremendous value in pre-exposure or post-exposure during the incubation period, okay? It also is effective in the symptomatic phase and in the pulmonary inflammatory phase, even the seriously ill phase. Whereas it takes hydroxychloroquine so long to build up a impactful dose level, therapeutic level, that ivermectin seems to be superior now, okay? Can you use both hydroxychloroquine and ivermectin, both old time, very low side effect profile, safe drugs, cheap? Yes, you can, and they have been done by clinicians and so forth. So he has this very nice, in this math plus protocol, and I think it's now called iMath because he added I for ivermectin. So that's a graph on page 3. The other thing is I wanted to show is, where is it? I lost my place here. Here it is, right over here. This is an outline of all the studies on ivermectin throughout the world. And in these studies, we're looking for randomized controlled trials versus observational studies. Although observation is very good, that's like what doctors observe. But we have 4 randomized control studies that all show a p-value of 0.00 something, value, and they're all to the favorable side of the 1 mark on the graph. So very good data on this. The other thing is I like to talk about, he has a graph in here showing the exposure incubation time, then the early symptomatic time, week 2. So week 1, you're exposed, you don't know you have it, you're building up viral replication. You may or may not be shedding virus. Week 2, you're shedding virus, you're symptomatic. And week 3, if you're not treated preventatively or anything, you'll start having maybe some of the inflammatory response, lower oxygen, shortness of breath, cough, and then of course hospitalization on to more severe disease. And in here, he talks about the medications for each of these phases. So preventatively, let's talk about that. So he comes up with a list for your doctor, your clinician, so you can copy this and bring it to your doctor and say, this is what I want you to do. And then tell them to read this like I have, look at all the literature. In preventative prophylaxis, ivermectin is like 12 milligrams day 1 and day 4 in the preventative or pre-exposure or post-exposure asymptomatic phase, and then repeat once again a month later. 12 milligrams.
That's it?
That's it. That's it.
Yes.
And tremendous results to get these great results in these randomized controlled trials.
Are there any negative side effects?
No, really. It was absolutely infinitesimally. This has been around for decades and decades.
Is ivermectin hard to get?
You can go to your veterinarian's office for heartworm for your doctor. Your doctor can prescribe it for you. So remember, you give a dose to your dog and then you give them a second dose a month later. Same here. You take 12 milligrams day 1 and day 4. If you're starting to get symptomatic, it's day 1, 12 milligrams, day 3, 12 milligrams. And the blood levels goes up right away, and then 4 weeks later, a month later, you take another 12 milligrams. So his prophylaxis protocol is ivermectin for high-risk individuals, day 1 and day 3, and then you can repeat that in a month. Vitamin D, 3,000 international units a day, vitamin C, 1,000 milligrams twice a day, and quercetin, 250 milligrams a day, melatonin, 6 milligrams before bedtime, zinc, 100 milligrams a day, and aspirin, 80 to 100 milligrams a day. Early outpatient protocol. So let's say you come to the doctor and you feel like you have symptoms. Ivermectin, 200 micrograms per kilogram is around 12 milligrams daily for 2 days. That would be day 1, day 3. Vitamin D, 4,000. Vitamin C, 2,000, 2 to 3 times a day. Quercetin, 250 milligrams twice a day. Melatonin, 10 milligrams at bedtime. Zinc, 200 milligrams, and a 325 milligram aspirin. So then I'm just pointing out that this was updated October 29th, 2020, and I just reviewed these, but this is a nice graphic colorgram. You can download this, give it to your doctor. And did I cover this one? Yes, I did.
That's a nice summary of this particular physician's review of the research out there, but the emphasis on the effectiveness of prevention, which we're not talking enough about.
Right, we have been. That's why all my patients are doing great. Now, what I want to let you know is I've had all my patients taking vitamin D from 5 to 10,000 a day, and I've been checking for years and years and years. Their liver functions, there's no toxicity with K2, so we have the D10,000 K2, 1 a day. We have the K-Force, which is the 5,000 and K2, 1 a day. So I personally, I'm a big woman, so I take 1 of each. So I'm on 15,000 a day for years. We have the liquid vitamin D droppers that have 1,000 units individually. You might want to put this in your children, a drop a day or 2. If you're very concerned, we have the very high dose, 50,000 international units, 1 a day for 5 days to suddenly lift you up. And then after 5 days, you stop this, and then you would go to 1 a day of something like this to maintain your levels. In the world of zinc, we have the orthomolecular 54 milligrams capsules, 1 a day. We have the multi-minerals, so you can get all the minerals and the multi-mineral reacted, and these are all high-quality amino-chelated base. We have the zinc, that is the 20 milligram in here. Now, I have had all my patients always on a multivitamin mineral that we have developed here for years and years and years. So I did not take extra zinc or multi-minerals, because I've been on a base dose all the time. And of course, because I do eat organ meat and beef and chicken, which is rich in all these minerals, but we've had it always in our multivitamin. So I've used our multi all the time, but there would be no problem if you felt you needed to take, an extra reactive zinc once a day for a month, use 1 bottle up to build up your reserves. We have our melatonin in the TLC Goodnight, and the melatonin in this is 5 milligrams, and you could take a double dose if you wish. Many controlled studies have been done and research physiologically on the antioxidant, immune-enhancing benefit of vitamin D plus the good sleep. We like the vitamin C, Vitality C, as a powder.
Liposomal, I think it is?
No, this is not liposomal.
Buffered.
This is
Okay.
buffered, and
Okay.
it's in the water. But we have the capsule forms as well. So we've been using this in our practice for a long, long time.
And I think per scoop, that's like 4 grams of vitamins.
4 grams per scoop. Yes,
4,000 milligrams.
4,000 milligrams, which exceeds Dr. Merrick's recommendation. Now, I have allergies. I'm B positive blood, and I use both D-Hist and LRDHQ every day of my life. And the quercetin is 200 milligrams per capsule, and I always take 2 a day. The LRDHQ quercetin is 400 milligrams, no, 200 per capsule. So I am getting
400.
I'm getting 400 milligrams
Of
quercetin every day just for my allergies. But quercetin is a key ionophore, acts like hydroxychloroquine, acts like ivermectin as an ionophore that gets the zinc into the cell. So this is what I've been using as a natural antihistamine so I don't get drowsy. And instead of aspirins, I've had all my patients, for the benefit of the rest of their body, use systemic enzymes on an empty stomach. I take 6 every morning. And these act as anti-inflammatory, anticoagulate, very mild anticoagulant benefits. And this, I have patients stop 4 or 5 days before surgery.
Right.
But the day after surgery, I have them resume it.
Okay. Well, wonderful information on some things you can start doing right away to boost up your immune system, start raising those internal storage, half-life of all of these wonderful antioxidants, things that have been proven and controlled in double-blind studies to ward off just any infection. Because of course we're talking a lot about coronavirus, but there's the regular flu. This is cold and allergy season, so all of these great things just have so many profound and wonderful benefits, not just preventing viruses.
Yeah, and we've done tremendously well. We have so many very ill heart patients, diabetic patients, obese patients, autoimmune patients, cancer patients, hypertensive heart patients, and they've all done well because everything that Dr. Merrick was saying, we've been doing for decades.
Right.
We've been doing this for decades. I wanted to bring up, I like Argentin.
Right, I do too.
And Argentin is nanoparticulate. It's not colloidal. It's better than what you can get over the counter.
It's a silver hydrosol.
It's a hydrosol, which means it's more uniformly and tinier particulate. And this has been studied even against Ebola. So if I sense I'm getting a cold, I'll squirt it up my nose, or I'll brush my teeth, I'll take a sip, I'll gargle, and then I'll swallow it.
Right.
I'll do that several times a day. I have it in the spray, the gel, and it has worked very well.
I use that. My family goes through that like crazy. We use it ubiquitously.
Okay.
We have it in a spray bottle for the eyes, the throat, the mouth.
Mm-hmm.
I have the nasal spray. In fact, we go through it so much, I buy the large bottle, and then if my little nose sprayer gets low, I pour it into it, right? If we get a cut, a scrape, if my baby gets a cut or a scrape, they make a gel that you can wipe the gel on.
The other thing we developed was our immune supplement, which is another source of vitamin D. This is a high-dose vitamin D in a capsule in a jar. This is like this one right here,
Right.
okay? So again, these are just to be used for 5 days,
For a short period of
for a
time.
short period of time, 1 a day for 5 days, and it has warning, not to exceed 1 capsule per day, and no longer than 5 days.
And why did we make this? Well, when the coronavirus first hit, when COVID-19 first hit, the supply chain everywhere
Sold out.
just got gobbled up. Vitamin
Yeah.
C you couldn't get, zinc you couldn't get your hands on, zinc, vitamin D, Well, there are so many that we reached out to our suppliers and found some ways that we could get it if they run low. And could it happen again? Absolutely. So we're doing our best to keep stocked of all of these things, but don't wait until it's there's another spike or another concern, or the media is talking a lot about this and these things fly off the shelf again.
Then we have our immune concoction, which has the vitamin A, C, B12, pantothenate, zinc, astragalus, elderberry. This has in it echinacea, L-lysine, and a couple of other herbs that have all been shown to have an antiviral effect. So we carry this as well. So when your doctor knows how to prevent things, you're going to do better off than waiting for you to show up at his door ill with something. And our whole focus here has been to prevent disease. And I have quite a few elderly, I'm in that elderly class. I'm above 65, well above 65. So.
All right, we have just a few minutes left. I've been keeping my eye on the chat. Most of these have been comments or quick questions answered. Let's see. We have one that says, can you talk about your no-carb diet? Is it keto or carnivore? Well, we advocate a very, very low-carb diet, particularly in patients with a standard American diet with very high triglycerides, high insulin, high glucose, fructose. And it doesn't really matter what you call it, keto or carnivore. Those are just labels slapped on dietary guidelines. We call our diet here, it would be more keto, I suppose, because we do advocate a ketogenic promoting diet, which allows your body to switch over from glucose dependence to keto utilization, which is the breakdown of
burning
fat.
Mm-hmm.
Right. So, and carnivore is just, that became popular with paleo and the CrossFit.
Paleo allows some low carb, vegetable, high complex carbs.
Paleo just says no processed foods, basically.
Right. And the keto sets a carb limit, let's say 20 or less grams of carbs per day. And so you could have green beans, you could have some lettuce, you could have some spinach. When you say carnivore, you're sticking totally with eating beef, chicken, just meats and things like that. I'm not against carnivore. If you have a specific goal and you want to do all carnivore for a month, I think you'll be very satisfied and satiated.
I had a question emailed into us at office at TLC Doctors. Can I put the Clinician's Preference Oil, omega-3 oil, in my hot beverage?
No, because it's very sensitive to heat. That's the whole reason why I exclusively have worked to order this from Dr. Pesek.
Right. Peskin. Right.
Peskin. Because of the very volatile nature of linoleic and alpha-linolenic acid.
It's very easily oxidized.
Right, and heat will do that.
This is a great oil to take cold, either just straight, which I do, or I love adding it on my salad. I think it tastes great on salad. So this is an oil you want to take cold. Don't introduce heat into it, but great question. Yeah,
they're thinking of medium chain triglycerides and stuff.
Making like a bulletproof coffee or something.
Or putting butter in it. And there's nothing wrong with that, but you are not made of medium chain triglycerides. There is more value to using butter because you could use the cholesterol in the butter, okay? Right. But linoleic and alpha-linolenic are essentially what's in your membrane, and that is what's really missing in the integrity of cell wall and healthy immune defense systems.
Right.
That's why we created it in our bar. Our bar should be out in just a few weeks now.
And this is a last quick question, easy to answer. Hydrosol is better than colloidal then?
Right, absolutely. Colloidal is clumps, okay? Clumps. Where hydrosol is a uniform distribution. That means the penetration is much deeper, and its virucidal, bactericidal, fungicidal qualities are much higher.
Right. And I remember when we first came across this Argentine company, they had sent out their hydrosol silver to several independent labs, and they compared it with some of the leading colloidal silvers out there. And they did petri dish studies and antiviral, antibacterial, and this was superior in every way. Not that colloidal isn't bad, but there's concerns with colloidal since there's more clumps of it. Is it being absorbed into the cell? Can you take too much of it and get that argyria or whatever that's called? Which you have to take tons of.
That's from homemade silver machines. That is sold over the counter. You really cannot get argyria where you look blue, from the silver in your skin. But I don't want to say it's not good to have any colloidal silver. There is some benefit to it. But if you're using this and you're going to pay money, you might as well get the highest quality. Now, that company, do they still have a
Sovereign Silver?
Sovereign Silver.
That's available over the counter.
But it's half strength.
This is the professional, only available through doctors. So if you go to maybe Whole Foods or Mother's or even Amazon, Sovereign Silver is made by the same company that makes Argentin 23. It's just not as strong. So this we prescribe to our patients, but you can get Sovereign Silver just about anywhere. Okay, well folks, that is just about all the time that we have for today. We're here.
I want to remind everyone to consider fasting on Friday to make up for the high sugar damage, because all I do all the rest of the month, December, January, and February, is fix all the immune damage and suppression of all this candy, garbage food eating. I am inundated with people saying, yes, I went off my diet, I ate too many carbs, and they destroy their immune system. Please have a Thanksgiving dinner, not dinners. And consider fasting.
Great advice, Consider fasting the day after Thanksgiving or the weekend after Thanksgiving for a good solid 24-hour or more period. And yeah, don't turn it into multiple days. I think that's great advice because that's so easy to do. I'll have Thanksgiving dinner on Thursday, and then at my Friendsgiving on Friday, and then Saturday we've got leftovers. All right, let's celebrate and let's enjoy the harvest and the food together, but don't let it leak into 1 week after another and fall into a holiday slump. All right, folks, we're here every Wednesday at 9:45 a.m. Pacific until about 10:15. We hope you'll join us next week. If you haven't already, please subscribe to our channel. We're on a goal right now to hit 1,000 subscribers, and that's going to unlock some more tools for us. If you're finding this content valuable, please like the video as well. If you hit the little bell next to subscribe, you'll be notified every time we post a new video. So again, thanks for joining us. If you come back to this video at a later time, look in the comment section. We'll be posting in the description the links to all the information that Dr. Althorpe shared with you today. Have a wonderful Thanksgiving. We're so glad that you joined us and thankful for your ears and eyes. Thanks, folks. God bless. Good.